I'd like to welcome you all to the final session of the day, and I would like my three panelists in the Leadership and Partnerships section to come on up as I introduce them. Dr. Regina Rabinovich is a global health leader with over 35 years of experience in the research, public health, and philanthropic sectors, focusing on strategy, analytics, global health product development, and the introduction and scale-up of tools and strategies attacking malaria. In 1999, Dr. Rabinovich became director of the PATH Malaria Vaccine Initiative, funded by the Bill and Melinda Gates Foundation to develop promising malaria vaccine candidates. From 2003 to 12, she was director of the Infectious Diseases Unit at the Gates Foundation, overseeing the programs for malaria, pneumonia, diarrhea, and neglected infectious diseases. From 2012 to 2024, she served as the ExxonMobil Malaria Scholar in Residence at Harvard University, where she is now emeritus and director of the Malaria Elimination Initiative at ISGlobal from 2015. She has served on the boards of organizations focused on global health and is now the chair of the trustees of the Sabin Vaccine Institute. She is a past president of the American Society of Tropical Medicine and Hygiene. A rock star. Next, Dr. Jimmy Opigo will be speaking. He is the program manager of the Uganda National Malaria Control Program. He has 22 years of public health work experience spanning medical practice, primary health care, public health, and national malaria program management. He has received training from University of Helsinki in Finland, Makerere University in Uganda, and the University of Antwerp. As the malaria program manager, he has collaborated, sourced funding, and implemented programs with various donors, including the Global Fund, the U.S. President's Malaria Initiative, UKAID, and Against Malaria Foundation. He has led the implementation of 3 mass net programs, initiated the mass action against malaria, political and multi-sectoral engagement, including at the level of the presidency and parliament of Uganda. He has built a remarkable, strong malaria program, both at the national and subnational level. He is now leading efforts to transform Uganda's malaria program into an elimination program, mitigate anti-malarial resistance, introduce molecular malaria surveillance, and malaria death reduction. He prides himself on building alignment and strategic partnerships, including with Rotary, and will speak specifically on strategic communications in his presentation today. Third, Dr. Anne-Marie Kimball is a physician, an epidemiologist, and a longtime Rotarian. She has been club president at the Bainbridge Island Club in Washington and co-chaired the COVID-19 Task Force for Rotary International in 2021 through 2023. She now serves as a representative for the president of Rotary International and represents Rotary International on the research committee of the polio eradication effort. She served as technical and strategic lead for the Gates Foundation Surveillance Strategy Formation and as senior program officer with the foundation. For 2 decades, she served as professor of epidemiology at the University of Washington School of Public Health, where she is now emerita professor. During her tenure at UW, Dr. Kimball founded and directed the APEC Emerging Infections Network and led research and training programs in Peru and Thailand. Her research focused on global trade and emerging infections. She is the author of the book Risky Trade, Infectious Diseases in an Era of Global Trade, and has authored numerous scientific publications and served on several Institute of Medicine panels. Welcome to our panel. I will now turn it over to Dr. Rabinovich to begin. Thank you.
Thank you, everybody. I don't know if you should be scared, but I am not using PowerPoint. I think hopefully that's a good thing. And I was not going to begin this way, but Philip referred to it, and that was really the beginning for me of the journey that you are on. He referred to a unique meeting that took place in 2007. We ended up calling it the Malaria Forum. At that time, the foundation had invested about $1 billion in malaria, and it was time to gather the partners together. And it became quite the event. In preparation for that, we did what one does at the foundation. You work on a strategy. And the question I needed to answer was, what's the end game? What's it going to cost to do what needs to be achieved in malaria, assuming it was control? And the people that supported us did all the financial assessment of cost of this, projected cost of vaccines, the bed nets, IRS, and came up with an assessment of $6 billion a year. So when we put those numbers on the table, there was bedlam. Because the very small malaria team said, that's a big chunk of overseas development assistance for everything, and you want it all for malaria? And I went, no, not necessarily, but we only have one other alternative, and that's the E word. And they went, the E word. I went, yes, we need to revisit eradication. Because you either spend $3 to $6 billion a year forever, or you have an end game. So that became what was discussed with a lot of fear and trepidation at the Malaria Forum. And for those of you that weren't there, I know some of you were, Margaret Chan stood up and said, WHO will take on this effort and we will lead it. And her people were astonished, but it was a vote of confidence, not against the capacity to do it immediately, but on the importance and the long-term necessity to have that as a goal. Did we have the tools? No. Did we have the knowledge? No. Did we have the staff? Well, we still don't, right? No. But we could create the tools if we knew that that was the goal. They were going to be slightly different tools. Ask MMV. Different kinds of drugs to treat, different kinds of drugs to eliminate. Did we have the knowledge? No, but we had the capacity to learn. And did we have the staffing? No, neither, but we had the capacity to build. What Tachi said, Tachi Yamada was the president of Global Health, and malaria wasn't his thing, but he learned it very quickly, as he learned everything else. And he said, imperfect tools, used imperfectly, can have enormous impact. Don't wait. You have imperfect tools. They are working. See what you can do with that. Now, resistance to diagnostics, vector tools, even potentially vaccines, people worry about that, to diagnostics, that's a form of resistance selection for something that the diagnostic will not cover, is a known threat. It's a biologically known threat that when you're targeting a part of a genome, a part of a parasite, a part of a pathogen, they're able to find routes around it. That's called resistance. And it is something that challenges and is a threat to known health systems. And we know now we have vaccines. I was told originally it'll be when the cows fly, and I went, no. I mean, now it's 2025, we have 2 vaccines. We know the challenge to diagnostics and to drugs. We know the challenge to vector tools, but you've heard about some of the innovations that are feasible in any of these areas. And I would like to add a fourth, because overcoming that is a priority, a fourth area. And that is, you've talked about it, but you haven't talked about it as a tool, because it sounds like a system, and that's data. You need surveillance. You need to be able to know where you are today. You're not going to know the impact of the chaos that's going to befell us in the next 2 years. You need to know if you're doing better or you're doing worse. And you need to know that so you know how to fix it. So the surveillance system includes the diagnostic. It includes the ability to reach the child to reach the clinic. It includes the data system into which it can be compiled, more than a book that sits in the closet and gets tabulated once a year. And I think the fifth area that we need to pay attention, sometimes with innovation, sometimes with politics, are the unexpected. And we're really good at that this decade. Who expected that as we launched 2 phase 3 cluster randomized trials, we'd run smack into not only typhoons, but also the pandemic? And who would have expected that what's happening in global politics, and of course down a little bit south from here, would be happening today? Also unexpected. But I think that's why data and keeping data as a technology, as a system that is essential to the overall effort is really important. Now, I talked about the $3 billion actually when a formal assessment by the community was done of what it would cost. It was more in the $6 to $8 billion range per year. And we've never reached more than 3 or 3.5. So that is a challenge and has been a constant challenge. But over the past 6 months, that has been exacerbated. And actually, this began in 2024, when 2 countries began to drop their overseas development assistance. The G7 was here last week, which I knew there was a G7. I knew the president went, and then he left. But I didn't know they went to the same restaurant we went to last night for a really great barbecue. But I did know that there was a report by Oxfam, an NGO that does this kind of analysis. And what they reported was daunting. Projection between 2024 and 2026 is that there will be a $43 billion drop in overseas development assistance for everything. So then I looked up what a billion is, because it turns out in Peru, a billion is a different number. It's 1,000 millions, or a billion. They're different numbers. UK has a different definition of a billion. So a billion, I'm talking about, it's 1,000 millions. 43 times 1,000 millions will have dropped by 2026 based on current projections. US, 33 billion, UK, 5 billion, Germany, 3.5, France, 3. And this is due to many factors. Politics is ugly, it's a constant. Climate, having to manage, we're all dealing with that. Migration, very big issue in Europe, very political issue in the US. War, I don't need to say more. Financial changes that are the impact of the expected and the unexpected. And I would say, I would add to that a bit of political chaos and economic uncertainty, which drives industry to be conservative with the investments and work that they are doing. The end result, very near term for us, is that Gavi may not reach its replenishment, and that's where we're depending for malaria vaccines as the new vaccine, the new kid on the block. The last I saw of the US budget, which has to be an error because they somehow think that Gavi has $7 billion in its coffers, which it does not. So that will need to be fixed, and I'm sure that all the advocates are working on that. But the Global Fund replenishment, which was originally targeting $18 billion, has been delayed and is likely to hit less than half of that. That has impact on us, it has an impact on TB, has impact on HIV, and has impact on every community. There is no way that you can divide up what we may have available and still achieve and cover everyone that we are covering today. So that is a huge challenge with global impact, quite likely, and probably starting this year. Now, we all know what's happened with PMI, and we actually don't. Because what they're doing is moving what they're going to keep of PMI over to the State Department. State Department doesn't do contracts and grants. So there's no one to answer the phone and say, yes, we will restart yours, no, we not, and make it happen. It's going to be a transition period, and a very difficult one because projects, when they're started, immediately staff were fired, and rehiring them is a huge challenge, if you can find them. So I think it's time for all of our voices because of the global impact. We were never going to reach that 6 to 8 billion needed by our original estimates, nor the global malaria plan. And it creates an opportunity. It creates awfulness and horrible impact at country level, which we are going to, as a community, suffer through across diseases. But it is also points to the importance of upping our game and I'm talking about all of us. Efficiencies. There are many examples where parallel programs are funded, where parallel research projects are done. We need replication. We don't need 18 versions of replication. Where difficult decisions are delayed because they're politically not acceptable. The Capitol has very low levels, but removing vet nets from the Capitol is politically a challenging thing to do. Where there are partners who are doing some of what you're doing, but not all of what you're doing. How can you work together? And sometimes that's a great thing and it happens, and other times it doesn't. And where there are potentials for alliances. And by that I mean for malaria to not just say we're the kid in town who has the money and NTDs doesn't, but NTDs know how to deliver MDA with community collaboration and community-directed programs. Pneumonia and diarrhea are generally vaccine programs or clean water programs, but they affect childhood, and it's the same community health workers that are being asked to take care of all of those. There's also importance of other sectors, and RBM has a multi-sectoral group, and a lot of discussions have been ongoing, but even simple things. The water community is the one that really should be dealing with the tanks of water that don't have covers. Malaria shouldn't be funding that. The water community should, but that should be a priority for them when they factor in the potential health impact of that. And I think that it's more than lip service that's needed. It's real action. It's real integration in ways that we have to say, well, I used to own this component of it, and now I won't, but I'll be able to work with others. So the question is, given all the change that we're facing, why am I here? I'm both overwhelmed and humbled by everything I have heard today. There's so much that has happened in the past 20 years that makes the task that you are taking on more feasible, more challenging, and more exciting. And I think it's time to begin to realize that together, whether we're talking politics, advocacy, implementation, that together we can do more than we can do as many individual single efforts. Nancy and Bill invited me to my first Rotary meeting. It was a luncheon, I think, in Seattle. 15 years ago. It was quite a while ago. And I went, Rotary, Rotarians had lunches and they do fundraisers. I had no clue what Rotary did. And I have to say that I learned more about what Rotary did when I did an analysis of lessons from polio for malaria, for the Strategic Advisory Group on Malaria Eradication. And I learned about partnership models. I learned about this research committee that the polio group has. Not that it covers all research, but you would think they have the vaccine, it's late stage. No, there were still things to be learned, there are still things to be tested, and still problems to be had, even though they were well defined with superb surveillance. So at this time, there is place for hope, and there's been huge advances. The numbers aren't great right now. The pandemic was really hard on everybody, and of course now we have the sort of reframing of the entire global health architecture. But what I learned from polio and from leading the certification evaluation for El Salvador is that elimination at a country level requires leadership, perseverance, time. It never went as fast as anybody wanted, and community action. And whether they were volunteers or community health workers or many ways that it's been done differently in different countries, it's worth reading those case studies. Where are we now with that concept of elimination? Well, I looked it up today. 45 countries and 1 territory have been certified. They are likely to be certifying the region of Europe in the near future. 35 countries are at less than 1,000 cases. This was as of the last World Malaria Report. And 27 at less than 100. That's not where we were 25 years ago when the Global Fund began. So it has improved more in some countries, and clearly Africa is the place where we need to focus efforts because of the enormous and escalating burden of malaria in those areas. The other lessons from polio for malaria included not only the role of civil society and NGOs, but the need for actors from both the North and the South. Clearly, elimination has to be led by the country government. And clearly, we need to do a much better job of helping where needed or listening to country priorities, because they're the ones that are facing the problems. But the other lessons were not only country leadership and ownership, but informed alignment. And you can only be informed and aligned if you only have data about the disease, but also data about what your partners are doing. And there's now databases that have what's going on in research, what's going on in implementation. RBM is collecting enormous amount of country data, and that did not exist once upon a time. So the change in funding and the change in politics imply the potential for a global realignment, which I cannot predict. Thank you, 1 minute. And of the actors and of the governance, and we need to leverage those changes. I believe that elimination as a country-led effort can be aligned to a global eradication effort. And the question is, are we practicing? I don't think we're practicing. I think we're doing. I think we're launched. Do we have a perfect plan? I would say no, we don't have a perfect plan. But I'm going to use a phrase from a previous speaker, said always adapt. We have a learning agenda. And am I an optimist? Well, yes. I led the first malaria vaccine initiative director, and to work on a malaria vaccine when I was told that it'd be when pigs fly, that we would have a vaccine. Yes, I am an optimist, and I remain an optimist. We don't want to wait for the perfect tools, and I think we listened to Tachi. Imperfect tools, implemented imperfectly, can have enormous impact, and that will be part of that pathway going forward, and I look forward to seeing Rotary's role in that. Thank you.